Snoring is a very common symptom of many of our family members. Now, the question is those who are having snoring, are all of them suffering from sleep apnea? Thanks to social media, now we are able to know that yes, if there is snoring, probably there is a sleep apnea. But the fact is not like that. All the snoring patients must not have sleep apnea because snoring is the most common symptoms of sleep apnea, but not at all a specific symptom. There are so many other causes where snoring occurs in absence of sleep apnea. So, in that case, if a patient came to our chamber with complaints of snoring, we have to take a detailed history. And in most of the cases, history would not be completed if there is absence of his bed partner. So it is very much essential to attend doctor's chamber with bed partner if you have the problem of snoring, because bed partner is the only person who can give the exact history. Bed partner can be patient's mother, father, brother, or wife who remain awake because of the intensity of the snoring. The snoring is so intense, the man or woman behind the patient, beside the patient, can't sleep properly. But yes, if they remain awake, they can observe another thing. What they will observe? They will observe the man was snoring loudly, loudly, intensely. Suddenly, snoring is decreased. In fact, he or she may not take any breath for few seconds. Then there is a awakening and then again start rebreathing. Why this happens? Why snoring happens? Snoring happens because of the narrowing of the upper airways through which air passes and the vibration of the wall of the airways produces snoring. In this way, if there is a critical narrowing, air may not pass within those critically narrowed airways, and that may produce apnea. Apnea means no breathing. But if apnea persists for few seconds, what that will do? That will ultimately lead to fall in the oxygen saturation of blood. So an hypoxia will be created, and that hypoxia will stimulate the respiratory centers in the brain, and that will make the patient awake and he will again start rebreathing. So this total phenomenon is known as observed apnea, and this observed apnea is the most specific symptoms of sleep apnea. If anyone's bed partner gives the history of observed apnea during night, we the physicians are almost certain about our diagnosis, though that needs verification through polysomnography testing. What are the other symptoms of sleep apnea? There may be unrefreshing sleep at night because the sleep usually remains fragmented. That is why, even after sleeping for 8 to 10 hours, the patient feel unrefreshing. There may be presence of morning headache also. There may be tiredness, weakness all throughout the day, and they may fall asleep frequently. That is known as excessive daytime sleepiness. And that excessive daytime sleepiness we measure through a scale named as Epworth sleepiness scoring. That will tell whether that sleepiness during day is significant or not. There may be mood swings all throughout the day. They may be depressive. They may be irritable. They may have sexual problems as well. And their intelligence level is usually decreased. And the most dangerous things is that cardiac abnormality. We have told about the hypoxia which occurs that during night, and that hypoxia injures cardiac muscles, and that may lead to arrhythmia, and that arrhythmia may lead to sudden death. So if we have prolonged, long standing, untreated sleep apnea, we may have cardiac death, sudden cardiac death in future. So it's very important to treat sleep apnea when suspected. So when you have all these symptoms, you should visit doctor's chamber, preferably a pulmonologist chamber, sometimes to ENT specialist chamber in order to find out whether you really have sleep apnea or not. If you have sleep apnea, you should be treated in order to prevent future sudden cardiac death. I think this knowledge will be of help to you. If you think this video is benefiting you, you should spread this knowledge to others. Kindly like and share the video so that I can get some enthu to make these kinds of videos in near future. Thank you.